Concerning results are being reported from a new study showing that chemicals found in black hair care and cosmetic products have a greater impact on black women's risk of breast cancer. The study found that chemicals called parabens are responsible for the increased risk in black women, but the same results weren't seen in white women. The parabens also promoted the spread of breast cancer cells in the body with a bigger effect in black patients. Joining me now to discuss, MSNBC medical contributor Dr. Ebony Hilton. And parabens are not something that I was completely unfamiliar with before this study because, you know, often if you're like on the Sephora website, it will note like there are no parabens in these particular cosmetics. This is a movement that cosmetic companies have had to respond to, but help us understand the direct link between chemicals like parabens and breast cancer. What does the data show us?
Right. The data shows that it not only helps promote the cells changing to be cancerous cells, but also to the progression of it spreading and being more malignant. And this is not just with parabens. We know there are many chemicals, not only in our cosmetics, but also in our food, in our air, in our water, that are contributing to increasing rise in what we see as cancer rates. And African Americans, unfortunately, we are time and time again, either through exposure through environmental racism, right, and what foods are actually allowed to be within our community due to zonings, we are at higher risk and placed at higher risk. And for Black women, unfortunately, what that translates to is we have higher death rates in every single state of the United States of America, and we die at younger ages.
One of the things I've talked about on the show is that my dad is a biologist, but specifically, he was a tumor oncologist. So I like to shorthand it. My dad was looking for the cure for cancer, everybody. That was what his job was for over 25 years. So I just know from him that there are so many different chemicals and so many things, like you said, food and cosmetics that can cause cancer. But what are we talking about here? How do we check the products before we purchase them to know what chemicals we should avoid? What ingredients should we be looking for?
Right. So basically, if you cannot name an ingredient, look it up to see what it is. There are plenty of apps that you can literally scan the zip code or the barcode to tell you whether or not this chemicals that make up this product have been deemed safe and or more risky for you. And it needs to be pushed not only on the consumer to do background on that, but we need to have policies in place of where we say that these things should not be allowed within products that are for human consumption and human utilization. We know that if you look at our food products, that there are certain food products in the United States of America that are literally illegal to sell in other countries and other developed nations. And the question is, why is that allowed here? How is capitalism taken kind of precedence over whether or not we actually live to reap the benefits of capitalism? It does not make sense. But there are many apps that you can go to looking at the chemicals that are listed within not only your foods, but also your cosmetic products to see, is this linked to cancer? Does this increase my risk? And particularly if you're already high risk because of either your family history or because of the demographic by which you belong to.
It's helpful information. I want to turn to the topic of COVID. On Tuesday, President Biden announced vaccines are now available for kids under the age of 5. I know a lot of parents out there have been waiting forever for this announcement. What do you want to tell parents out there who may be hesitant? Because I'm just going to acknowledge that some folks, even if they weren't themselves hesitant to get the vaccine, they may have some questions when it comes to a child under the age of 5. So speak to those parents at home. What do you want to tell them about vaccinating their children under 5 and how important that is?
Right. For one, I would hope they see that it did take a long time before this was rolled out because first safety had to be verified. And that is most important. The second thing I want them to know is oftentimes this was stated early on that kids are protected. But what we know is that 6 times the number of kids died from COVID than the flu this past year. Right. We had 600 children who are no longer with us from 2021 because of COVID-19. And there is now a method that you can use to help protect your child from being hospitalized and keep them alive to see next year, right? And what we know is that we're getting more and more variants, that this is not a time to let down our guard, that we now have BA4 and BA5 that are coming out of South Africa. We're looking at that. And how do we stay ahead of the game? And there's a saying, if you stay ready, you don't have to get ready. Keep your kids vaccinated, make sure they're wearing those masks, and practice those same mitigating factors that we've been doing now for 2.5 years.
Can you also speak to the question about long-term impacts of COVID infections on children versus, some questions about long-term side effects of the vaccine?
Right. And it's one of those things that the anti-vax movement has done a fantastic job at stoking those fears. What we do know is that COVID-19 is linked to a number of different disease processes that we can already trace. They say, well, you can't tell the long-term consequences of the vaccine. Well, yes, we can. In Q time, I've got my vaccine back in December 2020, right? I was the first person at the University of Virginia. We've now been able to track persons like me to see what has happened. Has anything changed? But what we also know is that we're tracking people who have COVID-19, children and adults alike. And what we know is that 1 in every 5 persons who've been infected with COVID-19 now has lingering disability where their organs, their heart, their lungs, their kidneys, their brain is no longer functioning in the same way that it was before they got infected with COVID-19. And when you take that developing child whose organs have not come to what it's going to be for the rest of their life, and you stress it out, and you put it on that treadmill and say, I want you to sprint. What does that do for the longevity of their life, not only in the quantity of their life and whether or not they will live a full life as we hope to live, but the quality of their life? What are the complications associated with that inflammatory response? So weighing those options, you do not want to let your child get infected with a virus when we don't know what that virus can turn into. And we know the implications of other viral issues that we have to face, and I'll give them an example. Hepatitis B. We knew that ran through in the 1970s, and now people have to have liver transplant because they have liver cancers related to that infection back then. We don't want to see that. We don't know what that's going to be for COVID-19, and we don't have to risk it because we have a vaccine.
It's so important, this information. I'm almost applauding over here. Dr. Ebony Hilton, thank you so much for helping us understand this. I hope that was helpful for the parents at home who are thinking through this and the questions about vaccinating their young children. Definitely go do it. It is important. Thank you again.
Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.